Hi guys, just Nicole here from London, Ontario. I just wanted to start off by saying I am not a health physician, so some of the things I might be describing in this video could be completely inaccurate, so don't take my word for it. Basically what I'm going to be doing is taking you guys step by step for the past 3 years that I've been dealing with my health issues, which involve interstitial cystitis and endometriosis. So, 3 years ago, I had bladder-like symptoms. So I went to a doctor and he prescribed me with an antibiotic that was supposed to help a bladder infection. Sure enough, a couple weeks later, I was not feeling any better. I went back and he prescribed me with a new medication. Same thing happened, wasn't working, went back for a third time, and he basically said it was in my head and to suck it up. So, what a gentleman. At this point, I switched clinics. I saw a different doctor, prescribed me with medication, same thing was occurring. For about a year straight, I seen about 5 different clinical doctors, and the pain was still present, and if anything worsened since the beginning. So, I was treated for a bladder infection, a kidney infection, a liver infection. I was told I was allergic to certain soaps and condoms, which none of those were correct. So, the last clinical doctor that I seen, I was seeing him for about, I'm going to say once a week for about a month and a half. At that point, my pain was, I had pain during urination, I had discomfort during intercourse, I had urinary frequency, urinary urgency, lower abdominal pain, sleeping problems, and pelvic pain. So I was in chronic pain at this point. Let's see. I was finally referred to a gynecologist specialist, which took about 3 to 4 months to even get an appointment with him. At this point, I was in school. I was completely stressed out, not knowing what was going on with my body, in pain every day, not sleeping, not eating correctly because of the pain. At one point, I actually passed out in school, was rushed to the hospital. It took me a little bit more seriously then, and I saw a gynecologist, I guess, the next day. She sent me out for some tests, and they actually found, during an ultrasound, they found ovarian cysts. They basically told me that they would go away on their own and that not to worry about them, although they are painful. Very. So my appointment finally came along with the original urologist that I had an appointment with. He treated me like I had a urinary tract infection, so a UTI. Sure enough, after taking an antibiotic for that, about 4 months later, I still was in chronic pain and nothing has changed. So he decided to do a scope. So basically he took a tiny little camera and looked inside my bladder. So from what I saw in the clinic was that the left side of my bladder was completely covered in what looked like tiny little red dots. So he said it was highly inflamed and it was irritated. So 2 weeks later, he got all the test results back and basically diagnosed me with IC, which is short for Interstitial Cystitis. At the time, I was like, pardon? Because I had absolutely no idea what that was. And some of you watching this will probably be like, what? So even today, I still don't even know exactly what it is. What they told me was it is a long-term chronic inflammation of the bladder wall. The cause is unknown, and there is no cure. Yay. So, from this, he prescribed me with an antibiotic called Almiron. So, from what I learned from that drug is basically it sheds the inside of your bladder wall and kind of rebuilds it. It takes about 4 to 5 months to actually start working where I'll know a difference. I'm in my 6-month trial right now, and I haven't really noticed much of a difference at all. So he when I was diagnosed with this, he also told me to try physiotherapy. At the time, I was like, I don't really think that that's necessary, but I was in chronic pain, so I, at that point, was ready to try anything. Since then, I have been seeing my physiotherapist once a week for about 6 months now. I have known, I've increased with my pain tolerance a lot. I've been feeling a lot better from that. I definitely encourage physiotherapy to anyone with IC. Basically, it's helped improve some of the symptoms. Like I said, there is no cure, so it didn't cure it or anything. The number one thing that helped me was it relieved pain during intercourse. So basically, for an IC patient, it kind of feels like having a bruise and someone punching it. So it's really not that fun. So she kind of prevented that pain, or subtracted some of the pain, so I don't feel it as bad. She also talked to me about physical quieting. So since I do have a sleeping problem, she gave me a couple tapes to listen to, kind of like a hypnotist helping you fall asleep. I don't listen to it every night. I usually forget, or I'm really tired, which is good. But when I do listen to it, I find that I have a better sleep, because I am waking up 3 to 4 times on an average night, because I have a urinary frequency. So my sleeping is way off. I usually sleep for only 4 hours a night on a good night. So give or take. Also, she suggested yoga. I have yet to actually try it. Similar to like the physical healing or quieting, you kind of like heal your body through different exercises, and I've never really been to yoga, so I don't know much about it, but it's something I want to try, definitely, if it's going to help. Back when I was diagnosed, my doctor also talked to me about an IC diet. So I'm going to list off some of the things that he suggested not eating, trying to avoid. It took me about 2.5 months to actually dedicate myself to the diet. I did find that it was helping a lot. It was just really exhausting and really sucked to not be able to eat what you wanted to. So the things that he said not to eat were aged cheese, drink alcohol, artificial sweeteners, chocolate, citrus juices, coffee, cranberry juice, meats that are cured, processed, smoked, canned, or aged, or that contain nitrates. Most fruits except for blueberries. That one hit me. I absolutely love strawberries and bananas, so that was sad. Onions, rye bread, seasonings, sour cream, sourdough, soy, coffee, tea, tofu, tomatoes, and yogurt. I can honestly say tomatoes and juice have been the absolute worst for me, so I will probably never ever touch them, even if I can. Just no. Okay, basically what I eat is chicken and veggies only. I find that going out to restaurants with my family and friends is somewhat difficult. They never really have anything on the menu that eliminates all of those things. So I have to be that girl that makes everyone's job super hard. So I try not to eat out that much. It's also not good for you. Let's see. I also do 10 different exercises a day that kind of help relieve, I guess, muscle swelling and other swelling down in that general area. Kind of hard too when you're constantly exhausted from not sleeping, and with me, I'm always busy doing something, so I don't always get around to doing all of these, which I should. So let's see, from the month of, I'm going to say September, I was severely bad with sleeping. I couldn't sleep. Like, I don't know what was going on with my body. It was completely worsened, so I went back to my specialist, and he prescribed me with amitriptyline. I'm not even sure if I'm pronouncing that correctly, but it is a antidepressant. I was a little bit skeptical about taking that because I'm not depressed, but he said it's going to help sleeping. It's a low dosage. You won't have to worry about it. So I started taking it. It lasted about a month, and within that month, I was not myself. I actually became depressed being on the pill. I wasn't myself at all. by means I went to school for fashion, and during that month I did not want anything to do with fashion. I wanted a complete career change. Just a lot of things happened that month that was not me. So I stopped taking it, realized what was happening. So I actually, during late October and November, I was feeling the best I've felt. I felt like maybe the Almiron was working. I was like, progress was good, physio was good, my physiotherapist saw great improvement, everything was great, and then December hit. December was one of the worst months, I could say, with my health disorder. It felt like all of my progress kind of went downhill, kind of lost it in a way. For about a week, I was in consistent and physical pain where I actually couldn't walk. There was one day I was literally laying on the floor and couldn't move. So I knew that something else must have been going on, like it just didn't add up. So I made an appointment with my family doctor back home. When I went and seen him, he kind of felt like something else was going on as well, that it wasn't just interstitial cystitis anymore. So he referred me to a gynecologist here in London, which took me about a month and a half to see, so much better than before. I actually went to this appointment last Monday, or this previous Monday, I guess you would say. I had two different doctors examine me, and basically what they found out was I do have something more than interstitial cystitis. I also have an endometriosis, which is, I don't know much about it at this point. I've just been diagnosed with it, but from what they told me is basically cells within my uterus are starting to grow in other places in my body where they're not supposed to. So basically kind of like little leeches growing outside the uterus, creating like a cobweb effect. Very painful. Kind of gross. One of the problems with an endometriosis is it can lead to fertility problems, which sucks. There has been patients with an endometriosis that have had successful pregnancies. My mom is actually a great candidate for that. She had severe endometriosis, and doctors told her she would never have kids, and here I am. So basically she had myself and my sister, we're 13 months apart, and she had us back to back, no problem, no trouble whatsoever. So basically in her situation, she was in chronic pain, so she went ahead and did the surgery. Now, right after her surgery, basically, she conceived. So some medical physicians say that like there's a certain time period between surgery and the regrowth of an endometriosis cells is when you can actually conceive. So with me being in the early stages, I guess, of an endometriosis, my doctor prescribed me with birth control, surprisingly. I've never been on birth control. I've never believed in the pill, but now I'm being forced to take it. Basically, I'll be taking that every day for the next 6 months without stopping. So I won't be getting my monthly gift anymore for a little bit, which I'm kind of excited about, I guess. But from that, it's basically supposed to stabilize the endo cells within my body, and in 6 months, if there is improvement, eventually will lead to, I guess, surgery. So the surgery is laser. So basically they'll be going inside and lasering off all the endometriosis. The only problem is that in many cases it has come back. So we will see how that goes. But that's where I am today. The reason why I made this video is I want to cause awareness. I know from experience when I was first diagnosed with interstitial cystitis and an endometriosis, watching YouTube videos and hearing other people's stories and what works for them and what doesn't was extremely helpful for me. I mean, not everything that everyone else works for, or not everything that works for everyone, I guess I could say. I've tried things that other women have suggested and they just didn't work for me, and I'm just basically explaining what works for me, so hopefully it will help someone else. I know that one of the most annoying thing is when people don't think that you're sick. I get it kind of quite often. You look fine, you look great, like you're not sick. You have absolutely no idea the physical pain that I'm feeling inside every day. So yes, I am very sick. I just, I live by the motto, look good, feel better. Seems to be working all right for me, I guess, right now. So thank you all so much for watching my video. I hope that this does help other people, like other videos that I've watched help me. If you guys have any questions, don't be afraid to ask me. And again, my name's Nicole. Good luck, everyone. Thanks.